Hi there, Dr. Tansavatdi here. So today I'd like to discuss with you about Botox, because everybody knows that Botox is very helpful for frown lines, for forehead lines, for crow's feet. Those are the most common areas that we inject in the face. But did you know that there are so many other areas that I can inject in the face? Face and neck, I will say. So we have about 17 areas that we can address with Botox. So let's start off with least frequent use of Botox that I use for, and then we'll go to the most common. So what I like to start off with is the area that I least do, and that would be sweating, or something commonly known as hyperhidrosis. I know that's a long term, but what it means is you can do this for the underarms, you can do this for the palms of your hands, you can do it for any area where there's just an excessive amount of sweating. Now, you have to be a good candidate for this. It's not just sweating, because all of us sweat, and it's a normal process to relieve the amount of heat that our body creates and allows our body to cool down. So it's not that we want to do this everywhere, although some people have asked me to. No, so what you want to be doing is that this is an area of the body, let's say perhaps, that you have excessive amounts that is uncommon compared to the general population. That being said, the two most common areas that I inject are the underarms and the palms of the hands. The palms of the hands can be quite tender, so typically we like to numb that area with a topical medication. So let's move on to number 2. So after hyperhidrosis or oversweating is nasal tip elevation. I'm sure you didn't think that I could do that with Botox, but I can. So I have been getting a slew of patients recently who have used threading from somewhere else. They've gotten threading done to the nose to lift the nasal tip. That is something that I don't highly recommend, because threading at this point we've been seeing it causing very visible threads to be seen in the nose, and 2, for the threads to poke through the skin and cause a hole in the skin, which lends to a non-healing wound and scarring. So I do not advise threading to the nose. But what can I advise for the nose? There's 2 things. Well, in a previous video, you may have already seen non-surgical rhinoplasty for the nose. But the other thing that I can do is put Botox to a depressor muscle in the tip of the nose that causes the tip to droop when we smile. And that nasal depressor muscle is something I can inject to lift the tip and rotate it up. So that's the second indication that I can use in the face for Botox. What's a third, less common, but something that I do get asked frequently too, is a gummy smile. Now, a gummy smile means that when we smile, I don't have that, but you could see all my teeth without the gums. Some people, when they smile, they see a lot of gums show. So how do you minimize that? Well, there's 2 options there as well. One would be the use of fillers in the lips, but a less common option that people don't request, but is actually less costly as well as very effective, is the use of Botox into the muscles with, this is going to be a very long name, the levator obliqui superioris nasii. Big, long name, but this little thin muscle goes all the way to the base of our nose here, and when we smile, it creates this crease here. If we can reduce the smile, then we can reduce the effect of that gummy smile. Now, this has to be done really well, and it should be done by a specialist who knows what they're doing, because if you overdo it, now your smile can be crooked. Yes, crooked. So you want to have symmetric injection, and it takes a good injector to know how to do that. All right, the next one down the list is taking care of neck and back pain. I know you're talking about, well, didn't I say face and neck? Yes, but I do get pain, patients who have pain in certain areas of the body. Particularly, they could have headaches, migraines, in the temples, they can have TMJ, and they can have neck and back pain. This upper neck in the sternocleidomastoid muscle and the upper trapezius is a very common area, particularly for people who work at a desk. You're constantly bending over, typing, shoulders are bent forward, and so with Botox we can take care of those really painful neck muscles that bother us at work. So, bet you didn't know that. All right, next one down the list is TMJ. So this is our number 5. TMJ is actually a very common thing to be happening for a lot of us because we hold tension in these muscles as well as other muscles in the face and neck. So TMJ's extension of the neck pain comes up and creates TMJ. And one of the things that can be combined with TMJ is addressing contouring of the jaw. So when we address TMJ, there's 2 sites for TMJ injection. There's one is the temporalis muscle, which is a big muscle, fan-shaped muscle here that allows us to chew with a lot of force. But the other muscle is called the masseter muscle. And by combining those injections, we can also contour the face. So with the jawline, we can make the shape more heart-shaped and more narrow. So you might have seen that in another video that I talked about. If not, go ahead and search for that about jawline contouring using Botox. All right, further down the list, we have malar septum. So what is a malar septum? This is number 6. Malar septum is a line that some people have in the lower eyelid that makes us look older or tired. And why does that happen? There's something called the orbicularis retaining ligament that extends from the skin all the way down to the bone, and it is going through what we call the orbicularis muscle, which is a concentric muscle that I inject for other reasons, but it is also something that I can inject using Botox to minimize the movement of that muscle that's creating a deep crease, which we call malar septum. Also known as just a fold under your eyes that make you look tired. All right, number 6, chin dimpling. Chin dimpling is something that can be created with the motion of the muscle called the mentalis muscle. Now, it is something that can lead to dimpling that looks like what we call a peau d'orange peel. It's short for orange peel look to the chin. As we age, that can really age us. It looks like a lot of wrinkles in the chin. And that is what Botox can really help with and minimize. And that is number 6. No, number 7. That's number 7. I'm skipping numbers here now. All right, number 8 is something some people will call jelly roll. It is the dimpling or the fold that you see under the eyes. I have a nice jelly roll. So the jelly roll is created by the muscle called the orbicularis that I mentioned earlier that can become very prominent, and by injecting that, you minimize that visible jelly roll. You can also address folds and creases that are created when you smile right under the eyelids. All right, number 9 is platysmal bands. So one of the things that can be addressed before we get to surgery for the neck are these little bands that start to show up in patients in the neck that starts to age us and show us that our neck is getting aged. So one of the ways we can address that is by putting Botox into that muscle to minimize those bands. All right, number 10. Jawline contouring. I mentioned this earlier with TMJ, but specifically patients who have a very prominent masseter, they may not have TMJ, but they may have concern over the fact that their jaw makes them have a very squared facial shape. So if we want to get the more heart-shaped face, we can address that by putting a bunch of Botox into that masseter muscle. You ask me, how much does it take? Typically takes 60 units, which is a lot. That would be a relatively expensive injection, but you don't have to do it very frequently. And that's something that can be done once every 6 months after you've gone into a good routine with this. All right, So after number 10, we have number 11, smoker's lines, or commonly known as smoker lines, which is the lip lines, the upper lip lines that are created, not necessarily from smoking only. It can also be just from the continued motion of the upper lip, particularly if we are sipping from a straw, which I highly advise, or any other motion where you're talking a lot and pursing your lips. Saxophone players, flute players, that would be another reason to see that. So for those lip lines, it's an easy injection, just takes a couple units to the upper lip to address those lip lines. All right, number 12, bunny lines. So bunny lines are like they sound. On a bunny, you see the lines on the nose. So those are these lines. I don't know if I can create them myself. I don't really inject this area for myself. But the bunny lines, when you smile, if you are really raising up your nose, those are the bunny lines. And that injection can be done with just a couple units to address those lines. All right, we're moving fast now. Number 13 is marionette lines. Is that right? Marionette lines. So marionette lines are these little puppet lines that we talk about right here. And as we age, before we get to needing a facelift, is how do we address those marionette lines short of using fillers? Another way to address that is to use Botox in what we call the depressor anguli oris. It's a big muscle, but what it does is it depresses and causes lines to show up in our lower face. That muscle can be addressed with Botox, just taking a couple units, and that will soften the fold that we start to see in the lower face. Number 14 is a chemical brow lift. So you may have seen some of my videos on using fillers for lifting the brows. But did you know we could also lift the brows using Botox in two specific areas? One would be addressing it right under the brow itself. I see some people who overdo it by injecting above the brow, and with that you can get the frontalis muscle and cause the brow to drop. You only really want to get what's called the auricularis oris muscle, which is that concentric muscle that I told you about earlier. When we squeeze our eyes tight, I don't know if you can see this, my brows drop. So by injecting around that muscle, we can prevent the brows from dropping. That's a brow depressor muscle. Another way to get a brow lift would be addressing up in the upper eyelids by doing a very tiny injection called a micro droplet injection of Botox. It has to be expertly done because otherwise, what other muscle is involved in the upper eyelid? It's called the levator muscle, which can cause your eyes to droop if too much Botox is injected into there. So that's a chemical brow lift. Next, we're going to number 15. So now we're going to more common areas, and that is the crow's feet. Those are the smile lines here. I won't go into too much detail about that particular injection, but you should particularly know that we don't want to do the injections too far into the cheeks because it can create a visible depression, not only a depression, but a lack of motion in our smile muscles. So there's a zygomaticus major muscle that if we inject into it will cause us to smile weird. It will have this fold here or a dimpling because that muscle was injected. So make sure you're going to a specialized injector who knows what they're doing. Number 16, forehead lines. So forehead lines are something that I like to inject, but with the forehead lines, I don't want to overdo it because it is the only muscle for the forehead lines. The only muscle that raises your brows is the frontalis muscle, but it's also a muscle that creates the lines in our forehead. So that's an area that we do not want to overdo, particularly for patients who want to get a chemical brow lift, who want to lift their brows. So we don't want to overdo that. And the very last, we save the best, which is number 17, are frown lines. That is the most commonly requested injection area. for good reason, because it makes us look angry to have those frown lines. It does not do us justice, and it makes us look angry, unhappy, and that's not what you want. So that injection is typically done in a couple spots in between our brows, and it takes a good amount to get that blocked. But once it is the most, I see the most happy patients from injecting the frown lines. And there you have it. That's the 17 areas that I have addressed with Botox and what I commonly use here in our practice. Thank you for tuning in. For more videos and for more information, please tune in to our YouTube channel at Faces by DRT1. Our Instagram is at Faces by DRT, and our website is at www.facesbydrt.com. Thank you.